So my name is Maria. I'm the mammography tech at Simmonds, Martin, and Helmbrecht at the Frederick office. And today we're going to be going over some questions that I ask each patient before their mammogram. These questions give you a lifetime risk score in your mammography report. It just lets you know the chance of developing breast cancer. The few questions are, is there any chance of pregnancy? Are you Ashkenazi Jewish? Have you ever had any previous imaging before? And if you're having any concerns, also if you have ever tested for the BRCA gene. We also go over questions such as, do you still get a menstrual cycle? How old were you when you had your first cycle? When was your last cycle? Also the age of menopause, if you've had a hysterectomy, and how many live births you've had, number and the age of your first birth, and if you're currently taking any hormones like progesterone or estrogen or testosterone, and if you're currently taking any birth control and the duration of that as well. We also go over some family history where you can let us know if any of your immediate family members have been diagnosed with breast cancer and the age, and if they've also tested for the BRCA gene. We also ask questions if you have any sisters or daughters in your household or in your family, or if your mom and dad have or had any sisters. We also ask if you've ever been diagnosed with breast cancer, and if so, you have to let us know the type and the age you were diagnosed and any treatments you have had, as well as any other cancers that you have been diagnosed with. After these questions, I also go over a consent form that just gives us permission to do your exam today and then to request any prior imaging that you have had anywhere else. And then I ask the patient if they have any questions or concerns about the mammogram, and if so, I can answer all those questions the day of your appointment and before we start your exam. Ready?
Yes.
All right, perfect. I'm gonna ask you to stand right over there for me while I set up.
Okay.
After we finish going over your breast history form, I will explain the procedure. The mammogram usually consists of 2 images per breast. Sometimes additional images are needed just to ensure that we have all your breast tissue. The initial images consist of compression for up and down, and then we do a sideways view. You should expect results from your mammogram within a week or so, and you can see those results on your patient portal, and you will also get a letter in the mail with your results. We do like to tell each patient when it's their first mammogram to please don't panic if they are a callback patient. That means that the radiologist saw something on their mammogram and they need to come back for additional imaging. If that were to be the case, please don't panic, do not think the worst. This is common when it is your first mammogram, and it doesn't mean that something bad was seen on your mammogram or that it's cancer. So again, if that were to be your case, please don't panic and do not think the worst. Your mammogram should not hurt. It feels uncomfortable, but it should not hurt. If at any moment you do feel pain, please let me know, and then we can always readjust.
Well, thanks for joining me for my first mammogram. It was honestly fine. I mean, it was squeezing a little bit uncomfortable, but honestly, nothing I would even think twice about. Maria was very professional and made it easy and talked me through the whole thing, so I felt very comfortable with her, and it was a great experience. I'm glad to have started this process and hopefully catch anything early that needs to be caught and stay up to date with my healthcare screening.